The pandemic is far from over, and it will not be over anywhere until it's over everywhere.
A stark warning from the head of the World Health Organization as the global pandemic enters its third year. Hello, I'm Arnold Naidoo, and this is The Heat. Six million deaths, almost 500 million infections, countless lives upended. In the 2 years since the World Health Organization classified COVID-19 as a pandemic, the whole world has been impacted. Cases are declining at the moment, but public health officials say the crisis is far from over. CGTN's Jim Spellman has more in this report.
2 years ago, the World Health Organization made this announcement.
COVID-19 can be characterized as a pandemic.
That evening, then U.S. President Donald Trump, who often downplayed the growing crisis, addressed the nation.
The virus will not have a chance against us. No nation is more prepared or more resilient than the United States.
But that was not the case. COVID-19 tore through the United States and many other countries with devastating results. Much of the world would soon go into an unprecedented series of lockdowns. Some countries like China, Australia, and New Zealand have escaped the worst of the outbreak by relying on quarantines, masking, vaccines, contact tracing, and testing. As 2020 wound down, vaccines became available, but they were not the quick fix many had hoped for. Even as vaccines became widely available in the US, UK, and Europe, there was reluctance among some to take the jab, and protest movements emerged. By summer of 2021, the Delta variant sparked another deadly wave of infections. In the U.S., current President Joe Biden blamed the unvaccinated and his political opponents.
The stink minority of Americans, supported by a stink minority of elected officials, are keeping us from turning the corner.
Meantime, poor countries struggled to obtain even a small number of vaccine doses. As 2021 wound down, the Omicron variant emerged and cases hit record highs in the U.S. and many other parts of the world. Omicron is now fading in most of the world, and globally, cases are falling quickly. But hotspots have flared up in places like the Republic of Korea, Vietnam, and several African nations. As we enter the third year of this global pandemic, the toll on humanity has been staggering.
2 years later, more than 6 million people have died. Although reported cases and deaths are declining globally, and several countries have lifted restrictions, the pandemic is far from over, and it will not be over anywhere until it's over everywhere.
Here in the U.S. and around the world, people are weary after 2+ years of coping with this pandemic. Restrictions are being lifted, but as we've seen before, COVID-19 may well have more surprises in store. Public health officials warn that we must all remain vigilant. Jim Spellman, CGTN, Bethesda, Maryland.
Joining us now is the chair and president of Access Health International, William Haseltine. His latest book is Natural Immunity and COVID-19, what it is and how it can save your life. Bill, great to have you with us.
My pleasure, thank you.
I want to get to your book a little later, but first let's talk about the statement from the WHO Secretary General, who said the pandemic is far from over and it will not be over anywhere until it's over everywhere. What do you make of that? Do you agree with that?
I absolutely agree with that. All you have to do is look around the world today. You see resurgence, particularly Hong Kong. China is now having a pretty hard go at it. And if you look even in Europe, you see a resurgence. People thought it was down, but over the last week, there's been a definite upturn. If you look in the US, the prediction of what's going to happen next takes place in our sewers. And around the country, we see a sharp uptick in the amount of virus in our sewers. So I don't think it's over yet.
We're now entering the third year of the pandemic. What for you has been the biggest surprises or the biggest challenges?
Well, I think the biggest surprise is that countries with the most developed healthcare systems have not fared well. That's including most of Europe and the United States, as well as many other countries. We in the United States have fared especially poorly, and that's been, I think, a shock and a surprise to most people. Certainly it has been to me. I also think that the changeable nature of this virus has come as a deep shock and very unpleasant surprise. I actually wrote another book earlier about a year ago, a little over a year ago, called Variants, the Shape-Shifting Challenge. Even I, who wrote that book, didn't imagine that we'd be where we are today, where the virus is changing so very rapidly. I think the third surprise is how well the vaccines worked to stop infections, but at first, then the variants overcame them, and now it seems the vaccines are pretty powerless to stop infection. But the good news is, if you have the right vaccine and you have enough of it, it may stop most serious disease and death. That's the good news, and it is a surprise.
You know, you say that one of the big surprises was that the most developed healthcare systems in the world, including the United States, failed to come to grips with this pandemic. Well, let's look at the United States as an example. I mean, we're getting close to 1 million deaths right now, the highest casualty rate in the world. Could this have been avoided? What were the biggest failures specifically on the part of the United States?
Well, the first failure was when in leadership that denied that this was going to be a problem and slowed down our entire response. We now have good leadership, and we're still in the soup, but it was a leadership failure. It was also a failure of some of our public health officials who didn't see the danger as an airborne pathogen early enough. They didn't see that the virus could be transmitted silently from someone who appeared to be healthy. We didn't understand that enough. There was plenty of warnings that that could happen. We just didn't take them seriously enough. And then, of course, there's been really puzzling political opposition. There's been taking a natural disaster, something like a volcano, and trying to politicize it has been a tremendous disaster, not only in this country, but around the world. And then in other countries, which you may have mentioned, such as New Zealand and Australia, they did a really good job, but politics got in the way. Once the election cycle ran around, they lifted restrictions, probably for political reasons, and it took off again. So we've seen some really unpleasant things happen. And part of it we could have prevented. We probably could have prevented much of it, but we didn't.
And then the vaccination program also got very politicized.
It also got highly politicized, and there's still a very large segment of people who refuse to be vaccinated. And it's very tightly associated with political beliefs, which is, again, really deeply unfortunate. Again, it's like trying to politicize an earthquake or a volcano. This is a natural phenomenon, and you have to deal with it for what it is, not what you want it to be.
You know, we heard a moment ago from the WHO Secretary General Tedros Ghebreyesus. He's also been talking about the challenges that remain. Let's listen to some of what he had to say about that.
The virus continues to evolve, and we continue to face major obstacles in distributing vaccines, tests, and treatments everywhere they're needed. WHO is concerned that several countries are drastically reducing testing. This inhibits our ability to see where the virus is, how it's spreading, and how it's evolving.
So here in the United States, we have seen the virus waning in some respects, but as you pointed out, in Europe, we're beginning to see new outbreaks there again. China is battling its worst outbreak since the initial outbreak in Wuhan 2 years ago. What is your assessment? Is it too soon to relax restrictions?
You know, restrictions go only so far, and I think people are very tired. Everybody's tired of this. I'm even, believe it or not, tired of this. But you have to look at what's actually happening. And it's really dangerous to relax your guard. We're going so far as having a great difficulty in getting the money that we need to provide vaccines and drugs for what may come. People in Congress are not passing the enabling legislation to buy the vaccines and drugs that we are going to need if this thing comes back, and it looks like it's coming back. That's how serious the lack of concern is, as if we haven't learned anything from the last 2 or 3 years. And it's not just this country. It's many countries around the world that are going through the same thing. You see Fear when it's at its peak, you see relief when it looks like it's over, and then we seem to forget it and move on. Gosh knows there are plenty of troubles in the world to distract us right now, but we cannot let up. I think Tedros was exactly right. If it's not stopped everywhere, it's not stopped anywhere.
Of course, COVID has affected people differently. You've got people who are asymptomatic, and of course, there are people who have died from the virus as well. We've also heard of something called long COVID. What exactly is that? Because a new study shows that there's been nerve damage in long COVID patients, even after a relatively mild case of COVID-19.
Right, that's emerging as one of the biggest problems for all countries that have had serious COVID pandemics, which is almost everywhere. And that is that we're now learning that no matter how mild the symptom, you may not even know you had it. Your brain knows you've had it. Your heart knows you've had it. Long COVID is the long-term consequences. Let's take something we've known for a while, influenza. We've known for many years that people who suffered from the 1918 flu and survived had a much, much higher risk for Parkinson's disease. That's something that we've known for a long time. And these viruses that affect so many parts of your body, including through inflammation of the blood vessels, can cause long-term nerve damage and other organ damage. And that's what long COVID is. It's a constellation of diseases that arise from the primary infection, but may occur many, many years later, even decades later.
Okay, I want to talk now about your book on natural immunity and COVID-19. Talk to us about that. How does that work? What is it?
Well, the first thing you mentioned that most people survive COVID. And that's not necessarily because of your antibodies, especially if you've had it for the first time. It's because of your body's ability to fight infections. And we have a very elaborate system that we inherited from hundreds of millions of years ago. Trees have it, grasses have it. Just think of what happens to anything that dies. It rots. You have a natural immune system that protects you against things you've never seen before. And that works about 90% of the time for COVID. Now that we know about it, now that we know how it works and how the virus counters it, I think we have the tools in hand to change that 90% to 100%. And there's some very interesting drugs that can tune up your natural immunity so that it looks like you're a kid again. One of the problems is as you get older, it doesn't work so well. But there are some drugs that are going through clinical trials now that look like we may be able to tune up your natural immunity to not only prevent the disease, but if you get it early enough, reduce that 90%, or increase that 90% to 100% success.
William Haseltine, thanks so much for joining us.
You're welcome. Thank you.
Okay, we still have a lot more to talk about. Let's get to our panel right now. Peter Chin Hong is a professor of medicine and an infectious disease specialist at the University of California in San Francisco. Gustavo Ribeiro is the founder and editor-in-chief of The Brazilian Report, and Chris Smith is a consulting virologist at the University of Cambridge and co-presenter of the Naked Scientists podcast. Thanks to all of you for being with us. Chris, let me start with you. Almost 500 million people have been infected since March 2020. 6 million people have died from COVID. The United Kingdom is beginning to relax restrictions. Let's listen to what the Prime Minister Boris Johnson had to say.
COVID will not suddenly disappear. So those who would wait for a total end to this war before lifting the remaining regulations would be restricting the liberties of the British people for a long time to come. This government does not believe that that is right or necessary. Until the 1st of April, we will still advise people who test positive to stay at home, but after that, we will encourage people with COVID-19 symptoms to exercise personal responsibility, just as we encourage people who may have flu to be considerate to others.
So, Chris, what did you make of what the Prime Minister had to say there? Is it perhaps a little bit premature to lift restrictions?
He made reference to the flu, and this is a useful benchmark because it's something with which we have a lot of familiarity. Everyone watching this programme will have had a run-in with flu. It's universal. But it's also something which we've got a long-term track record of monitoring and treating. So it serves as a useful comparison under these circumstances. And when this new pandemic first emerged on the world scene, it was far more serious than flu. And in some people's cases, it was 10% lethal. On average, it was about 1% lethal. Flu is at least a tenth less lethal than that. But now, 2 years on, we are in a very different position. We're in a different position for several reasons. Foremost among them is that we have vaccines, which we didn't have before. And those vaccines, as you were just hearing, are incredibly effective. And 90% of the time, they will convert what would otherwise be severe disease into non-severe disease. We've also got drugs, which we can throw at the problem now. And so it's very important to see the situation as we are confronting it through the lens of now and the threat that it poses now, not the original threat that it posed 2 years ago. And the current mortality rate, the so-called infection fatality rate with COVID-19 in the UK at the moment is actually lower than if people were challenged with flu. Now, that's not to say that we haven't got lots of cases of flu, lots of cases of COVID and very few cases of flu. We have got lots of cases of COVID, so therefore the numbers of people being afflicted with it are high, but the risk to those people is lower than the flu. We don't have these sorts of restrictions and constraints because of the flu and things of that ilk. So it's kind of strange that we would want to have them for COVID. That's the rationale that the policymakers are using to reduce their restrictions.
So, Chris, when you say it's got to the point now where it is a non-severe affliction, would you put that on the same par as what? The flu or a cold?
Well, the flu being the benchmark that it is, you can ask, if I catch the flu, what are my prospects of very severe disease or perish the thought that I will perish? And I can make the same comparison age for age with coronavirus infection. And at this point in time, with the vaccine track record that we have in the UK, very high vaccine penetration, more than 90+%, especially among older people, we see that the infection fatality rate, the chances of you perishing if you catch COVID, are lower for all ages at the moment than they are for flu. And under those circumstances, it seems sensible to step back from some of the more severe approaches that we've taken. But as Patrick Vallance, who's the UK Chief Scientific Officer, and also Chris Whitty, who's England's Chief Medical Officer, said when Boris Johnson made those announcements at one of the Downing Street press briefings, they said, look, think of this as like going out in the sunshine, make hay while the sun shines, but take your umbrella, because if it does start to rain, we're going to have to run for cover. In other words, we know how to deal with this if things turn worst again. That's what we need to do as our plan B.
Gustavo, let's talk about Brazil. The number of confirmed cases in Brazil is, it stands at 29.5 million. 656,000 people have died. In fact, it's the world's third deadliest pandemic after the United States and Russia. But on the other hand, 75% rather of Brazilians are vaccinated. Talk to us about the response from the government of President Bolsonaro. What do you make of his response in the last 2 years?
Well, overall, it was one of the worst responses that we had in the world, because President Bolsonaro was a COVID denialist for most of this pandemic. He was a vector of disinformation. Until now, he badmouths vaccines. He has always talked against all the scientific consensus that we have in terms of isolation, of social isolation, the use of face masks. The thing about Brazil, and this is what is interesting here, is that we are a federal country, and states have a lot of power, states and municipalities, and we were able to fight the pandemic more because of the initiative of states and municipalities. We had the state of São Paulo, for instance, was the first state to bring vaccines to Brazil and to essentially force Jair Bolsonaro, because of political pressure, to ink vaccine deals with Pfizer and with Sinovac, which he resisted as much as he could. Now the president is trying to downgrade to get the health ministry and to get Congress to vote to downgrade this health emergency from a pandemic to an endemic disease, which in practical terms doesn't change anything. Endemic just means it's here to stay, but not that it's less severe. But experts have warned that in the imagination of people that could lead the population to believe that the crisis is over and that we could go back to normal. That has already happened to some extent. Most states in Brazil have lifted mask requirements. And because we have a highly informal economy where people need the in-person economy to make their livings, at this point, new COVID restrictions would be unfeasible at the time. The Omicron spread, we saw the highest infection rates, and it was January and February 2022 were the deadliest months since August 2021.
Peter, let's look at the situation in Europe. Europe's starting to roll back some of its pandemic precautions, but there has been a rise in cases and hospitalizations in these countries, in the United Kingdom, in Ireland, in the Netherlands, Switzerland, and Italy. What might that mean for the United States, where we are seeing the lifting of certain mask mandates? Other measures are being lifted as well.
Well, I think, Anand, that people beginning to look at what's happening in Europe with a lot of anxiety and nervousness. Of course, Europe has been the bellwether of pretty much every single variant before it comes to the United States. So again, it's, looking at a fractured healthcare system as, there's talk of removing it from an emergency designation. So, people are a little bit anxious, but like what Chris was saying, I think we're preparing via the national strategy outlined by President Biden, as well as the strategies outlined by some states like California, to be prepared to have a storehouse with diagnostic tests, with masks, have a test to treat plan. It all sounds good in paper, but of course, money talks. So it's convincing Congress to fund with, $30 billion as President Biden's plan will cost, up to $100 billion, and that is really where the narrative is right now.
Peter, one of the issues we have seen here in the United States is that control over the pandemic, control over the virus has been left to the states. There are 50 states and there are 50 approaches to these things. But are you now finding that most of the states, the majority of states, are actually on board with this program?
I think there is enthusiasm for the program. For most states, again, it's along political lines a lot of times, with the more democratic states tending to favor it a little bit more, just because, as Professor Haseltine said, it's become so politicized that you take medical interventions like pills or monoclonal antibodies, and all of a sudden your embracing of that philosophy, marks you as belonging to a certain political party.
Right.
But in general, most people are on board, but of course, costing $30 billion is not chump change.
Chris, you were talking to us a moment ago about vaccines and how effective they've been in the last 2 years. How is it that scientists were able to develop these vaccines so quickly? I mean, we know in some other cases with other diseases like measles or mumps, it's taken years for vaccines to be developed. But here, in this case, it was developed very, very quickly. And what do you think needs to be done going forward?
Well, the reason they were able to go so fast is because a lot of the technology was already there behind the scenes. For instance, we've seen in the last about 20 years a whole host of new and emerging infections begin to confront us. And most recently, Zika got people very worried, very excited, off the back of Ebola just a few years before that. And because of the challenge thrown down before us by those emerging diseases, there'd been quite a bit of investment in new, novel and interesting ways to harness some of our better understanding of medicine and biology to try to deal with them. And that included the vaccine backbone that became AstraZeneca's vaccine.
Right.
It also included the technology that's become both Moderna and Pfizer's vaccine, the mRNA vaccines. So really, the technology was there ready to go. It hadn't been formally rolled out in some cases in humans, but it was very well understood in terms of how it would work when it met with the immune system in a mammal like us.
Right.
So really, it was a question of getting the virus and identifying it. That happened very, very quickly just
Right.
over 2 years ago, and then working out what bit do we want to take from that and putting it into the vaccine.
Gustavo, in Brazil, Brazil was once rated as a country which would become a major economic power alongside other countries like Russia, India, and China. But then, of course, we had the pandemic. Where do things stand right now?
Well, I mean, we didn't only have the pandemic. Brazil had its worst recession between 2015, 2017, and then the pandemic came. So we were already in a poor position when the pandemic hit. Right now, we are in a very poor economic state. We have a ballooning inflation, which is not only high, but widespread. Services are up, commodity prices are up, food prices are way up, and but salaries have stagnated. So we are in a situation that for the past half decade, or for the past decade, we have seen Brazilians lose purchasing power.
Right.
We have seen the state dealing with ballooning debt. So it is a pretty precarious position at this moment.
Peter, I want to ask you a question that I did ask William Haseltine, and that is, I mean, you're a doctor, you're a specialist. What for you were the biggest surprises or challenges in the last 2 years?
Well, for me, Anand, the biggest surprises were really, the lack of alignment of politics and science. I know he mentioned that or alluded to that earlier. And the reason why that is important is because we rely, not just the US, but many countries in the world, on the CDC for giving us clinical guidance on the ground. How do we take care of a patient? We didn't have that for much of the pandemic with the previous administration. So we had to solve all these problems on our own. We actually, as physicians and clinicians, took to social media to really talk about pathways to treat patients, to really look at the evidence together. So I think that was really a downfall. Of course, dazzling science, but it only gets you so far.
Chris, very quickly, I've got about 20 seconds. What is the risk of the current virus mutating into a more virulent form?
I'd say it's very likely that the virus will mutate. Will it become more virulent? Well, that depends on who you put that question to in terms of who's getting it. Because a highly vaccinated population, it's obviously going to be a much lower risk for them than an unvaccinated population or one who are dealing with other chronic diseases or age. And so it really matters where that outbreak happens. And that's why, as Tedros said at the beginning of your broadcast, you had that quote from the WHO, it's not over anywhere till it's over everywhere.
Right, and that's where we have to leave it. Thanks to all of you for being with us. That is it for this edition of The Heat. I'm Anand Naidu in Washington, D.C. Thanks for watching.